Welcome back to CTV Morning Live. Now, I've been pregnant twice. I have two beautiful daughters, but I can tell you during those pregnancies, I got to know all the shows that were on late night and probably most of the infomercials that were on between, I don't know, 2 and 4 a.m. And we are talking about the ability or the inability to be able to sleep while you're pregnant. And there's an amazing study that's being done right now out of the University of Toronto. And joining us is one of their nursing students, Bridget Doan. Great to have you on the show.
Hi, nice to be with you.
And there's a wonderful new study that's out that you're really and the focus is completely on women while pregnant and sleep. Is that right?
Exactly.
What was the need for the study?
We know that sleep problems are more common in pregnancy, so things like restless leg syndrome, sleep apnea when you have problems breathing, and even insomnia. And we know that these sleep problems can increase the risk of fetal and maternal health problems. So there's really a need to do more research and determine what factors cause these sleep problems. And
we were talking about actually some of the studies that had come out earlier this morning in the Ottawa Citizen, but you're saying most of the studies are usually done with men rather than women.
Exactly. 75% of the studies done on sleep look at men and not women, even though for women it's essential, especially in your childbearing age, to get enough sleep.
So what are we looking at in terms of the participation and the type of women right now that you're looking for?
We need first-time moms who are less than 20 weeks pregnant with their first child, and they would be involved in doing 4 phone interviews. So 3 of their phone interviews would be before they have their baby. So the end of their first trimester, their second and their third, and then a month after they have their child to talk about both the mom's sleep and the child's sleep.
Are you looking for a correlation at all between the amount of sleep that mom is getting while pregnant and what happens with the baby after?
Exactly. So they're trying to determine what the sleep quantity and quality, how that affects the outcome with the pregnancy, and also how the baby sleeps, depending on how the mom slept.
And you're also, if I'm understanding correctly, looking for ways to be able to deal with some of these issues after looking at this study and how to be able to help women.
Exactly. Without knowing the factors that cause sleep problems, we can't help women who have sleep problems. So the end goal is to come up with why people have problems sleeping during pregnancy, and then move forward and help nurses, nurse practitioners, and doctors help people sleep better.
Now, there's nothing that we can probably do to be able to, the pee breaks that essentially start to set in, and you literally are up a couple of times a night having to go to the bathroom. And a lot of the time you're saying it's going back to sleep.
Yes.
That's a main issue.
For every woman it's different, but that's often a common concern. The most important thing with sleep in pregnancy is to really make it an important part of your schedule. In the book, this is when I'm going to sleep, and no matter what, I'm going to try and sleep and give myself permission to sleep. It's hard when people are also working and have other commitments, but you really need to tell yourself, I need to sleep for the good of my health and my baby's health.
And I can understand now why you're doing it with the first-time mom, because with kids running around, that's all going to
that adds another confounding factor to the study.
Okay, so how can people then get involved?
People can go to our website, Stremler Research, and on that link, they can actually sign up for our study, and we'll send them eligibility information via email. You can also check out our booth at the Baby Boom Show, which is being held in Ottawa this weekend, which is free for admission.
So free for admission, and of course the Baby Boom Show is always a lot of fun, great information, so you can sign up there. Keep in mind you need to be prior to that 20 weeks, because you need them before they reach the 20-week mark.
We need to capture that first trimester sleep, and so we need them before the 20 weeks.
So for those of you that are first-time moms and are right now at the early stages of your pregnancy, it might be a great study to take part in terms of helping your own knowledge, and then that in terms of how they can help other women. And I believe there's a $25 gift card available too that will be offered to you for signing up.
All women who take part in the study get a $25 gift card for a grocery store or a drugstore, and it's open to women across the country, so anyone in Canada can participate.
Perfect. So if you know a friend, a great place to send them. And good luck with your studies.
Thank you very much.
And it's funny, there's a whole bunch of you on the project, and they sent the nursing student. A great experience for you.
Yes.
All right, we are going to take a short commercial break. We're going to be back with the top news stories. Of course, there's huge alert for New York City, for Washington, with the anniversary of September 11th coming up on Sunday. We'll have those details with our top stories right after this.